Okay, good afternoon. My name is Jingjing Xiang. I'm the professor of nursing at Columbia University School of Nursing. It's my pleasure to welcome you to today's exciting event titled Indigenous Perspective on Aging and Policy. We are honored to have Obama scholar Dr. Poki'i Balaz join us to share her insights and expertise. Before introducing Dr. Balaz, I would like to take a moment to express our gratitude to the co-sponsors, the Alzheimer Association, the Chamber of Commerce Hawaii, the Hawaii Pacific Gerontological Society, Columbia World Projects, and Columbia School of Nursing. Your support is greatly appreciated. Dr. Balaz served as the interim executive director of Ruralina Home and has devoted her career to promote senior health, with a special focus on memory care and advocating for underserved population. As a native Hawaiian and geriatric nurse practitioner, Dr. Balaz has seen firsthand how a cultural-informed caregiving improves health outcomes for aging individuals, as well as the way cultural values motivate the community to participate in the continuum of care. With her extensive clinical background and focus on optimizing resources for the treatment of Alzheimer's and dementia, Dr. Balaz is well equipped to address senior care issues through public policy. Accepting invitation from both her congressman and governor to contribute to the Native Hawaiian Advisory Council and Policy Advisory Board for Elderly Affairs, Dr. Balaz has worked on legislation that protects the interest of aging residents and that educate families on the complexities of healthcare for their aging relatives. Dr. Balaz served as the immediate past board chair of the Alzheimer Association Alaho chapter, has received numerous accolades, including the Alzheimer Association's Advocate of the Year Award, a certificate of honor from the Hawaii State Legislation, a congressional commendation from Congressman Kahale, recognition in Pacific Business News 40 Under 40, and inclusion in Hawaii Business Magazine's 20 for the Next 20. As a double board certified family nurse practitioner, Dr. Balaz holds a doctoral in nursing practice for University of Hawaii at Hilo and an executive MBA from the Scheidler College of Business at the University of Hawaii. So during the presentation, please put any question you may have for Dr. Balaz in the chat. But we have allocated time for a Q&A session at the end of the presentation. So without further ado, I will hand it over to Dr. Balaz so that we can begin. Thank you.
Thank you, Dr. Sheng, for that wonderful introduction. And I'd also like to take a moment to just say thank you to Dr. Stone, to Kadra and Bridget for all their work in putting this presentation together. And I very much appreciate the opportunity to talk with all of you and share my experience with everyone here. Let's just give us a moment as we get the slides ready. Well, all right, I guess we can get started. Thank you, Kadra. So again, I just would like to say aloha to everyone. My name is Dr. Poki'i Balaz, and I will be sharing with all of you my journey today, and through my journey, how my culture has influenced my work in aging and brought me to working into policy. Real quick, before we get started, I just want to say aloha to everybody in Hawaii who is tuning in, and thank you so much for the comments in the chat, to everyone here at Columbia and beyond who is also joining us, and a special hi to my mom who is watching and tuning in from Papakolea. And so aloha Papakolea, thank you so much for joining today and for your support. Okay, so let's get into it. So this first slide that I'm opening up in is showing kind of a accumulation of my work. This was the Alzheimer's Aloha Chapter Walk, not 2020 but 2021, we were coming to the end of the pandemic. We were still in virtual, and this is my family, my nephew who's autistic, who's with us, my mother, my partner John, and my father in the middle. And we were getting ready to take my father on his walk around our community. And it was a great time, and a great time to meet neighbors and talk about the association. And I love starting off with this slide because this really kind of hones in on how on my work with aging and this sense of community and sense of value and responsibility, and with all the aloha that I have to the association, who helped me so much in my journey. Kadra, could we go to the next slide, please? All right, so I culturally, as a Hawaiian, and in my culture, I will be talking to you from what I learned from my parents as well as my grandmother. As we say in our culture, not all knowledge comes from one source, but I'll be sharing with you what I took from them. And so very much as part of my culture, it would be to introduce you to my parents, to my grandmother, and to those who were very pivotal in my life and taught me, my values and everything that basically I need to know, in a sense. But it's very, very culturally appropriate that we introduce to you who we came from, because our genealogy is very important to us, as well as I'm a culmination of all of those who came before me and all those who helped me along the way. So I will introduce just 3 people, because if I introduce you to everyone and we did the genealogy, it would take up the entire time and we wouldn't be able to talk about anything else. So I would like to introduce you to my father. He's the one that has the Santa hat on. His name is John Kelly Hi'analu Okalani Matthew Balaz. My father is of Irish, Hawaiian, and Czech descent, and his name is the chief that serves the heavenly waves. Very much, it's in Hawaiian culture, our names usually have a literal translation, and then there's usually a kauna or a deeper meaning or behind it. And so as his name means the chief serves the heavenly waves, it's very much speaking to his ability to be that connection between our physical and spiritual realms, as well as his ability to navigate and lead. And then right next to him, his powerhouse, my mother, Teresa Moana Balaz. Her maiden name was Insiang. And Moana refers to that deep part of the ocean. That's not the part that's behind me. That picture was taken from the shore. But that deep part, speaking to all of that wisdom and depth that she holds to her. The other woman that you see there smiling with the red lei, that's my grandmother, my father's mother, and her name is Eunice Keloha Kualoha Ku Poki'i Balaz, and Hale Ro Balaz, excuse me. And she was Irish and Hawaiian. And my grandmother is very, very special to me, as I'm named after her. She was a native speaker. She was born and raised on Hawaii Island, in Poki'i and Keahialaka, and she was very well versed, not only in our language, but our culture, our traditions, La'ala Pa'al, and many of the old traditions. And so thank you for bearing with me and letting me introduce to you my parents and my grandmother and these wonderful humans who have been part of my journey. Real quickly, I'm going to introduce some of the Native Hawaiian perspectives, and this is, thank you, Kadra. And this is not all inclusive of everything coming from our culture, but I chose and picked some of these. So we're definitely, going to be talking about aging and policy. And so of course I'm going to start off with kupuna, and in our culture, the Native Hawaiian language, this word refers to elders. And when we think of our elders in our culture, words such as knowledge and wisdom and values and keepers of our tradition and those who pass things on, that's what comes to our mind. And sometimes in Western discussions, when we're talking about aging, It circles around those who are maybe disabled or need help, and that is very much true for a certain part of the population. But older persons are also very vibrant and alive and are able to be independent and do so many things. And so from our perspective, or Native Hawaiian perspective, as my grandmother taught me, is that we value our elders. We value them because they have all this generational knowledge and wisdom from their life experience. And you can definitely see that in our culture. And it reminds me of a Hawaiian proverb, or Hawaiian Oyal, which talks about how the Hawaiian stands with their back against the future and eyes fixed upon the past, because it's in the past that we can find answers to our present day dilemmas. And so taking care of our kupuna in their golden years gives us access to finding those answers for our future solutions and present day dilemmas. So just a little tidbit there. Kuleana, it really translated, it talks about responsibility, but it's a lot more than that. It's carrying on your responsibility that was given to you, whether it was through your name, because very much for us, when we are raised in, when you name a child or give a Hawaiian name, the child should be raised in that name. And for many of us, there is usually somebody who names the children in the family. It was my father. Now it's my sister. My sister is the genealogist and hula dancer. I also have a brother, and he's the science guy and does botany and plants. And so this kuleana that we carry comes from our name, our culture, those who came before us. And so we carry that with us in every space that we're in. Intergenerational knowledge is very important to us, like many other cultures that I've become aware of. And it speaks to the two bookends, right? The children and our elders, and how do we bring them together to make sure that that knowledge is carried on. And so in old times, many times the grandparents took the mo'opuna, or the grandchildren, and that was how that exchange was done. And when I was growing up, because I'm named after my grandmother, my parents definitely was like a modern version of being Hanite, or that informal adoption that I was just explaining. So I spent a lot of time with my grandmother, and she passed down a lot of that cultural knowledge to me. And of course, so did my parents. And you can also see stories like this, where like if you come to a party, a luau, I know a lot of people here have been to Hawaiian luau's or would like to go, but we will serve the children and the kupuna first, or we will make the plates for the kupuna and bring it to them. And that is not always because they're not able to, it's to show our respect for them and how we value them. Or like I'd go shopping with my mom, and we come out of the store, and some young boy says, "Oh, auntie, let me grab those bags for you," and helps her to the car. So it's just our way to show respect. In our culture, we look at everything as a community, not really individualistic or separated, and we try to work together as a collaborative whole to move forward. And then, of course, in our culture, and I'll just end here, my grandmother, grew up, oh gosh, in different times in Hawaii, and so learning from her and my parents about being able to have this sort of duality when you live in the world we're in today, and being able to navigate within this cultural world that we have, the Native Hawaiian world, and as well as being able to navigate within this Western world. And so very much sometimes it feels like living between two worlds or having one foot in each, but I'm very much appreciative that I learned very early on how to be part of these two spaces, and sometimes they can complement each other, and at other times it can be opposing and challenging. But I'm still glad to have had this experience. And although I'm speaking to you about my Native Hawaiian culture today and those perspectives that come from Hawaii, is a mecca for a melting pot of Asian NHPI, Native Hawaiian Pacific Islander cultures coming together. So much more reminding me of New York, as here in New York, it feels like there's a melting pot of the entire world here. And I really love being able to see and explore, so many different cultures. Next slide, please. So just a little bit, I just wanted to give a little bit more background on I guess who I am. This is still, local style. We use this time to build a relationship, to tell about each other, to build this trust. So I'm still going to tell you a little bit more about me, so we can kind of have this exchange, which is very cultural too. So, like, who am I besides the wonderful introduction that Dr. Chang gave me? And for those of you who don't know me, so first and foremost, I'm part of a family. My parents, my sisters, my nieces, my nephews, my other half, my brother, all of them. And one of the most important roles I'm playing right now is that of a daughter. This is me and my father when we were being covered by Next Avenue, and she was taking pictures. And this is, many of you see us kiss each other on our cheeks, which is very appropriate, but also in our culture, this would be a more formal way, forehead to forehead, and to exchange our breath with each other. And so this is me before the shoot, getting ready with my father, saying aloha to him, and also asking him, if it's okay to start, and to bless us, and to be there with us. By this time, my father was nonverbal and couldn't really move physically, but that doesn't mean that I still couldn't speak to him. And so that's the picture that she caught, which I thought was fitting for this presentation. I'm part of a community, my own community, the community in Hawaii, the state, this national community. And I think, this community, that word can be interchanged in so many spaces. I'm a clinician. I got my doctorate of nursing practice from the University of Hawaii at Hilo. That program was geared to rural populations, underserved communities. And then I focused in on gerontology and dementia populations and caregivers. I also have a master's, as Dr. Chang said, in nursing education, my executive master's in business administration with a healthcare certificate, and my bachelor of science from the University of Hawaii at Manoa also. As an executive, I worked as an executive of Lunalilo Home, a Native Hawaiian trust that was created by one of our past kings when the Hawaiian Kingdom was still when there was still a Hawaiian Kingdom, and with a mission to continue to care for elders across Hawaii. I also became an educator in the community, teaching about Alzheimer's and dementia, teaching at the universities. I am part of some research projects. I'll forever be a student. I think life is, learning is forever. And I'm also part of Ala'aula Pa'au 3-year program that is really looking to put a cultural practitioner in every home. And currently at this end, I'm an Obama Foundation Scholar, and we're gonna talk about that then, how that got me here. But first and foremost, the big role that I play is being a caregiver to this wonderful man that you see in the picture, as well as, to my family and my community. So next slide. Here's a quick snapshot of Hawaii. This isn't all the data. I just really wanted to briefly go into some data. So we have about over 1.4 million people across the state. Most of us, as everybody knows, is on Oahu. And we have about, 37% of our population towards older adults. But within that, a population that I very much get to focus on is those living with Alzheimer's and other related dementias. And we have about 29,000 living in Hawaii right now, with it expected that to increase to 35,000 by 2025. We have about 60,000 caregivers, and we have millions of caregivers across the nation. Specifically in Hawaii, they're providing about 91 million hours of unpaid care, which is over $1 billion of value in unpaid care. And if we're looking across the nation, that's about 477, I think, billion dollars in unpaid, 477 billion dollars in unpaid care that is being provided across the nation, and really acting as the backbone to our long-term care infrastructure. Some of the challenges that we're facing in Hawaii. Oh, I'm so sorry, Kadra. Next slide, please. Apologies, everyone. So now some of the challenges that we're facing in Hawaii, and this is not unique to Hawaii. This is also very much across the nation, is that we're looking at our options and our choices. What do we do as we're aging in place? Although that is the main, that is the main choice for many families, and people want to stay in their homes and age in place. So how do we do that? How do we create policies to sustain that and support that? How do we create programs at the community level, at the state level, at the national level? How do we do this as a global community? As the World Health Organization is leading the efforts for the United Nations in the Decade of Aging, and how do we come together to make this happen? And if we are choosing a setting, is that an adult day center? Is that a skilled nursing facility? Is that an assisted living? Like, what are our options? Looking at the financial health of caregivers and care recipients, our direct care workforce is shrinking, not just in Hawaii, but across the nation. And what can we do to turn that around and support that? In terms of more along the lines of looking at Indigenous perspectives and other perspectives, how does cultural competency play a role in this? What part does that play in policies? And some of the other things: independence, engagement, technology, education, and resources. But going back to cultural competency, even in Hawaii, we create these programs that are at larger levels to disseminate into the communities. And so how do we make sure that we are taking in different perspectives? For instance, like for Native Hawaiian culture, access and utilization to these resources is really important, but we need somebody who can come in and teach them and understand that in our culture, caring for someone is embedded in us. It is something that we know we're going to do when our loved ones begin to age. And so expecting that they're just going to be welcoming to having someone else come into the home for support, that might not be a reasonable expectation. But how can you be the connecting piece to let them know that if and when they're ready, whenever that time comes, if it ever comes, that there are options? And that's what I try to do, is remember different perspectives. My role as a clinician, my role as a caregiver, my role as a community member and a Native Hawaiian, and how can I bring this together? And I will share, when we first needed to get respite help, my mother was not so excited about having extra help coming in, but in the end, it was a decision that we needed to make as a family, and that was something that really supported us. And just to share right here, on the slide, I'll just share with you really quickly how this all came to be for me. My father, we knew that something was wrong, and that back in those times there wasn't a lot of talk and funding into things about Alzheimer's and dementia. But I had graduated and I left. I had moved to the States, and by the time my father got his diagnosis, I was still in the States, creating a career. By then I was in California working at Cedars-Sinai. And my mother and I had a conversation, and it was decided that I would come home to support her and my father and to become a caregiver. And nothing in the world or nothing in my medical background prepared me for that unexpected role I was going to embark on as a caregiver, and experiencing all those challenges we talk about, the mental challenges, the physical challenges, as the disease progresses and you have to change and lift and move and provide range of motion and feed, and then the financial exhaustion that comes when the supplies are coming in, when you're having to try to figure out what can you afford in the community, when caregivers relating to financial health are not able to work because they have to care for someone. All of that started to hit. And so my kuleana, my responsibility was, what could I do? What was it that I was going to do to try to help in whatever way, shape, or form, in aging or in policy, as I began to fall in love with policy, to try to alleviate other people from having to repeat my story. And so that's really how I started getting into this. And I was raised by kupuna, so my time with kupuna when I was a floor nurse, I gravitated towards them. And so it's been a privilege and an honor to care for my father. Excuse me. And I also think that it brought me back to where I was supposed to be, because I wanted to be a plastic surgeon, but returning and being in aging spaces was where it was needed and where it belonged. Next slide, please. And so, again, just really quick snapshot, because this is where a lot of my work takes me. There's 53 million caregivers around the nation, 18 million specifically when we're looking at dementia. Out-of-pocket costs are ranging at $7,000 for caregivers who are just caregivers in general, and about $12,000 a month for those who are caring for someone with dementia, Alzheimer's, or other related dementias. When we look in terms of lost wages, caregivers cumulatively are losing about $522 billion, and employers are losing about 33 billion. And so what can we do about this? And so some of the things that we're looking at is expansion services, looking at how can we expand tax credits and FMLA programs, how can employers tweak their policies and procedures and the way that they're offering, what kind of environment can they create for caregivers, what kind of compressed work weeks or hybrid or telehealth, how can we support caregivers so that their financial health can be viable so they can continue to support the care recipient and themselves. There are caregivers who are children up to older adult and spouses. There are caregivers who are having to choose between paying bills and buying food. And this is something that we definitely need to address. And our direct care workforce, if we don't have anybody to staff our facilities and we don't have people to provide respite care, then caregivers will continue to fill that void. And so how does this tie into what I do? So it's the values that were instilled in me that I shared with you in a previous slide, that the way that I value elders, the way that I was taught through my culture, is why this is so meaningful to me. And the way that I look at the journey, to be a partner on the journey, and hope that I can treat everyone the way that I've treated my father and taking care of him, and really looking to make a difference. And the way I gravitated towards policy was the executive director of the Alzheimer's Association Loa chapter is with us today, LJ Duenas, and his wonderful team. And when I first began my journey, the association was very much right there by my side, and through them was when I first began to do advocacy and policy work. And being part of the advocacy team was caregivers support in the community. I was facilitated support groups, then was able to work on policy through the association, which led me to then begin working on task force at the state level and working on other aging policies at the state and the national level. And that was really to create macro level changes that could really help many people, not just across our state, but across our nation too. Next slide. And so through these policy committees and through what I was just sharing with you, it is my way to carry on my kuleana, my responsibility, and to honor those who came before me, and to honor my culture, my elders, and the communities that I serve and that I'm part of. And so on this slide, you'll see that these are some of the initiatives and organizations that I've had a great time to be part of. And so, of course, the Alzheimer's Association will have a chapter in there. And one thing that I've loved about LJ and his team is that when they came on, they're very much honing in on how can they tailor programs and policies. While the association is a national program and there are things that are started at the national level, how can they bring it down and tailor it to the different populations that we have across Hawaii? And definitely was supportive of doing things in the Native Hawaiian community and listening and hearing to what they needed and how they felt. And so how can those programs be tailored to fit those needs? And then of course we have Papakalea, led by wonderful people, Dr. Adrian Dillard and Hunikeka Oha, and their amazing team, who lead a community that is very much, how do I even explain it? They're very much able to build a community within a community, and are able to provide the community, along with their amazing team, so many things that they need, whether it's housing, financial sustainability, and bringing the community together and bringing in supports for our kupuna and bringing in what they need, medical support. It is amazing to see what they can do. And if anybody's going to, anyone wants to look at what you can do with a cultural perspective, definitely that is the place to stop and leaders in that community to talk to. It's amazing the work that is happening out there, and I've had the pleasure of being able to work alongside them and be embraced by their community, and I will forever appreciate that. And also the kupuna there are vibrant and lots of fun. Love them. I also get to do things like sit on the policy advisory board to the Executive Office of Aging and discuss strategic planning for our state, looking at task force teams for long-term care services, workforce improvement, quality improvements. When Congressman Kahele was in office, I was able to sit on his Native Hawaiian Advisory Board. And a great example of how we can do things at the national level and bring it down, and why I get involved with policy, is looking at the CDC bold infrastructure, which we definitely get to be a part of in Hawaii. And I sit along many other members in the community on the Native Hawaiian Advisory Board for our Healthy Brain Initiative, which is tied to CDC Bold, and looking at and creating the Native Hawaiian roadmap for that initiative, and really being supportive of the community in Hawaii. We definitely have a Kupuna Caucus, the Hawaii Pacific Gerontological Society, Papa Ololakahi, who also created the Native Hawaiian 3R team. And through these initiatives, I get to work closely at the community level and also working at initiatives in the state and the federal levels. And they're just doing such amazing work and tying in all of the cultures of Hawaii and bringing that to the forefront in how we view and look at policy and how we carry out programs. And so these are some of the Native Hawaiian organizations that are doing tremendous work, many of them that I just named. I would also like to say, finding Native Hawaiian organizations out here in New York was amazing too, as Halavai is out here and definitely perpetuating our culture across the community. KKV, Kukuakalihi Valley, an organization that I'm still with in Hawaii, and they are such a great example of community leaders who serve. They're an FQHC, a Federal Health Qualified Center in the community, who is serving in Kalihi. And what I love about KKV is that in every program, in every policy that they do, and everything they create, they are always looking at it from the perspective of their community, the eyes through their community, and making sure that that gets put into whatever program that we are doing, that we are creating, and what we are rolling out. Next slide, please. Apologies. I'm so sorry. These are some of the community organizations throughout there, and in the corner you'll see Best Buddies Hawaii, and they're not a Native Hawaiian organization, but that is an organization that my nephew is part of that really perpetuates inclusivity, and they are very much honing in on making sure that NHPI is also very much a part of their organization. So I very much appreciate that. Next slide, Kadra. These are also some of the other initiatives that are happening in Hawaii, some of them that I have spoken about, and some of them that I have got to be a part of. The Kupuna Caregiver Program, we're very excited in the state as we were the first in the nation to provide this type of assistance to our caregivers across the state, where we were able to subsidize or help with the financial health of working caregivers so that they would be able to provide care to their care recipients and their loved ones, and also be able to continue to work. We were also able to create a dementia statewide coordinator position, and have been very effective in creating and making advancements in our aging spaces. Also taking a look at La'au Lapa'au and how can that be integrated back into our lifestyles, Native Hawaiian lifestyle, through hula, through food, as we see food as medicine, and how can that be woven into what we are doing and given out to our communities. And so I think in all these spaces, whether it's community, state, or nation, when I'm involved in any of these initiatives, I take into account the perspectives from everyone, all parties that are involved, but also remembering who I am, the values that have been instilled to me, the way that I see. And so in every initiative and every policy that I'm a part of, that I get to be a part of, I think it's remembering how I value, especially if we're talking about aging spaces, elders, what responsibilities or kuleana have been put on me through my work, through my culture, through my ancestors, and through the communities and collaborative partnerships that I worked through in Hawaii. And how do I bringing all of that together and making sure that that is put into the policy. And many of these policies, regardless of if it specifically says Native Hawaiian in there, is accessible for Native Hawaiians. And at the very core of it is, once we set these policies, is how do we then effectively roll it out, making sure that we take into account the perspectives of those that we are creating these initiatives for, that we are helping, that we are trying to help. And so I think that's a key component of anything that we do, or that any of us try to roll out, is remembering who we are and who we're doing this for and why we're doing it. Next slide, please. And so, of course, we were just in March, we were at the Capitol speaking with our legislators again, and these were some of the initiatives that we were just talking about at the federal level, macro level changes to help constituents across the nation, the state of Hawaii, and across. And so we were talking about CMS and their FDA approving the way that they're approving therapies and treatment for Alzheimer's, asking for reauthorization of things as the National Alzheimer's Project Act, the Alzheimer's Accountability and Investment Act, the Comprehensive Care Act, and asking, of course, for funding to further further research at the NIH and to continue CDC boat, especially since Hawaii is also connected to the CDC boat. And of course, all of this wraps around to initiatives to not only do research, but bringing equity to research, making sure that it is representative of all people, and also the people conducting the research, our caregivers, and looking at diagnosis, treatments, early interventions. And so this is really a lot where my passion and purpose comes from. And of course, in the end, to see a world without Alzheimer's or any other and all other related dementias. And as you can see, it's, we had a great time, and we did a lot of great work out there. And so even when I'm sitting there in these spaces, it's so important to me that I make sure that I bring the perspective of a Native Hawaiian perspective to it, perspective of being somebody from Hawaii, and also part of this national and global community. And how do I bring that to the table and support that when we're talking about these huge policy changes that are, affecting people across the board. Next slide, please. And so, of course, a huge part of this that we came to is talking about the Obama Foundation Scholars Program. And for anybody who is interested in the program, the website is on here. It's obama.org/scholars. If you would like to specifically take a look at the program, my work in the community, this program is really focused on, as you can read on the slide, giving rising leaders from the United States and around the world who are making a difference in their communities the opportunity to take it to the next level. And it's really young leaders creating a social impact and using that impact to affect change. And as you can see, if you look at us, it's 12 of us from 12 different countries coming here. And one thing I've learned about being part, and I've loved being part of this group, as we're talking about in perspectives on Indigenous, perspectives on aging and policy, is many of the wonderful people that you see in this picture are working on policy also. And that I've learned so much about different countries and cultures, and how much our cultures affect everything that we do, and in every aspect of the work that all of us 12 are doing. I can very much see how everyone's culture, how their perspectives are influencing their work, what they do, their drive, and how it also came to create their social impact in their countries around the world. And so briefly, I'll just, the countries that you see represented in here are New Zealand, Nigeria, Kazakhstan, Syria, Greece, Mexico, United States, Indonesia, Colombia, the UK, Uganda, Venezuela, and Poland, and Ireland. And so I think it's a very fitting end to show that how we can come together to create initiatives that are going to impact us all for the betterment of the future and generations to come, and how that culture is tied into everything that we do and in all that we do, and it's our breath of life. And I'm very just proud to be part of this global family. And so in that end, I just want to say thank you to all of you. And that this is a picture of my parents after we've put Dad in his chair so they can hang out, and that this is why I do what I do. That my father getting Alzheimer's was definitely one of the biggest challenges in our life, and it changed our life forever. But that it wasn't all, we talk about it all, so much aging and Alzheimer's, dementia, and the challenges we face, but there's so much love and life and such amazingness left in that disease that for me, when I became a caregiver, it really takes me back to that proverb. I was able to always look at what have we done in the past that was great? What did we do that was not so great? Where are the gaps in services and challenges? And how can I take all that information and then produce sustainable, effective changes for the future that can bring better days for us in the present and for the future generations to come. And becoming an advocate came from being a caregiver and from my lived experience, looking and seeing where the gaps in services and through the struggles and the challenges I had, and advocating for what should and can be done. And then from there, then becoming involved in policy, because at the policy level, we can really create changes that can affect so many people in so many ways. And that other slide that I'll end with sharing with you about workforce development and caregivers, financial health, that's a big part of my work right now in the Obama Foundation Scholars Program that I'm working on, and a part that I hope to continue through policy and community initiatives. So I just want to say again, thank you to everybody who was able to join today. And if you would like to keep in contact with me, that's my email address here at Columbia, and also my personal email address. And I would be happy to connect with all of you at any time to talk more. So thank you.
Wonderful, great. Thank you so much for the wonderful presentation, Dr. Balaz. We'll now move forward to the discussion portion of the event, and we will invite the audience to submit your question for Dr. Balaz. Okay, so the first question we have here is from Danara. Okay, so she wants to know, how do you allocate your time to do so many initiatives and excel at everything?
So what Zanara is getting at is self-care, if I'm understanding that question correctly. And in the community, when I would teach programs, I would teach a lot about caregiving 101, or we call it, or dementia, Alzheimer's basics, talking about really trying to hone in and give caregivers the knowledge, skills, and tools to be successful in this caregiver journey, and understanding the disease and how to deal with it. And that is one of my loves that I've missed doing actually recently. And in the point of this is that in both of those presentations that I do, or that I teach in the community, and also have been able to roll out at Lunalilo Home and Kukuakilihi Valley in educating our team members, is that I teach very much about self-care. And that is definitely a pivotal point in being a caregiver, because if we cannot take care of ourselves, then how can we care for someone else? And if we run on empty, that can very much affect the care that we give someone. And I will admit that I have been through burnout more than once. So how do I do it, Dinara, is, I think part of it is time management, learning and experience, and thinking out of the box. So as a caregiver, like the beach behind me, I grew up there as a child. My parents, we spent every weekend there. I learned how to dive, surf, fish. It's how we also fed each other, fed ourselves or our family. And I couldn't make it to the beach anymore, so I had to get creative. I needed 5 or 10 minutes a day to just, to just be with me. There is a pool very close to my house, but when I have my father with me and no one's home, I can't go to the pool for an hour. Somebody has to be with him, right? If he aspirates or he needs to get turned or changed. And so we bought a pool, like a kid's pool, and put it on the lanai and filled it up with water. And I would go in the pool and chill out and float, or sit in the pool and lay back and stare at the sky and remember the days when I would be sitting there with my father, and that would give me a 5 or 10 minute break while I could still lay eyes on my father. And so those are the little moments that you have to get creative with to give yourself sometimes just that little break that you. So thank you for the question.
That's wonderful experience. Yes, I cannot agree more on we need to take care of ourselves in order to take care of others. I think this for the nurse professional as well. We need to take care of ourselves in order to take good care of our patients, right? We need to how to manage the burnout. Okay, and I really like the creative way to make your own pool in your backyard in order to release your stress. Okay, that's wonderful experience to share. Any other questions for an audience? Okay, while waiting for more questions, I have a question to ask Dr. Balaz. Could you share a little bit about your experience as an Obama scholar? Like, was the application process challenging? And what are some of the highlights of the program?
Oh my gosh, was it challenging? I think some of the scholars are also with us today. So, scholars, you're definitely able, or I welcome you to add in anything you have to say in the chat too, or if you would like to share. But I think the program itself, though, is unique. It's unlike anything I've ever been part of, and I think the word transformative is fitting. It has definitely transformed my life. It has elevated my work. It has given me platforms and connections, not just through Columbia's extensive networking, through the community in New York, and I will forever be grateful for that and take that with me. I'm not the same person I was when I came here 9 months ago. I don't think there's any way to be. And the process to get here was challenging, it was stressful, it was exciting, it was all of those things in one. And to think that you could be chosen to be one of the 12 from around the world to come here and be part of a global network to effect a change across the entire world was unbelievable to I just couldn't believe it. I'm also the first scholar from Hawaii. And so that was very exciting to me to represent Hawaii as I came to Columbia University and Columbia World Projects. And I'll forever be grateful to this experience and this time.
Thank you. And we have one more question coming out from the audience. I'm sorry, I probably cannot pronounce your first name correct. But the question is, how do you think about the future of aging and adult care, given the overall aging population, reduced funding, and increased technology advancement, and increased demand for the time family members?
Thank you, Lushala, for that question. So I think when I'm thinking about the future of aging, and yes, it's very much a space where we need funding and technological advancement and everything that you mentioned. But I'm hopeful. We need hope. It's why we're part of the Scholars Program too, right? As we look to hope, the President of Hope. But that when you're surrounded by people, many people who are involved in these initiatives, like in Hawaii, which has a very vibrant aging community, and because in Hawaii maybe we're lucky it's part of our fabric and it's part of the culture. I mean, we have a Kapuna caucus, as I mentioned earlier, in our state legislature totally focused on this. We have community initiatives going around from some of those programs that I was sharing with you, and communities coming together. That I think that I have hope that things are going to change. Also, aging in place, long-term care, direct care at this time is becoming very engaging for our legislators on all levels. It is, as that population is growing and the silver tsunami is coming across and the dementia wave is coming across, and that we are understanding that the infrastructure that we build may not be able to support us much longer, that we are right now creating the future, that we are involved in initiatives as we're producing task force, as we are looking how can we provide sustainable solutions. So to your point, some of what I was mentioning earlier, my work now looking at caregiver workforce development, direct care workforce development, there are states who have moved forward with initiatives looking at providing more services at the state level to caregivers in the workforce, looking at creating national long-term care programs, insurance programs, looking at expanding FMLA, as Hawaii was the first to create our initiatives. There are many other states coming along. So I don't think that this is something that's going away or that we're shying away from. I think it is something that we're taking head on. And then with the Alzheimer's Association, they is very good at getting bipartisanship in many of their initiatives. And so I have hope, and I think that together we can do it, and we will do it. We have to. And of course, places like Columbia University, having establishments like this that has an aging center, the School of Nursing, the Center on Health Policy, the Mailman School of Public Health, and the Aging Center. When we have places like this coming together, so much can be done.
Great, thank you very much for sharing that input. Any other questions? Okay. So since we still have time, I have one more question, Dr. Balaz. So how do you think what you have learned from your own culture can be applied to address the needs of other vulnerable population within the U.S.?
I'm so sorry, Dr. Shea, could you repeat the last part of that? From my culture, what could I apply?
So can you, what do you think you learn from your own culture? Okay, how can you think it can apply to address the need for other vulnerable population in the United States?
So I think there's a lot of similarities between, I guess, quote unquote, minority populations in terms of how we see aging and being Native Hawaiian, but not just Native Hawaiian, because I am Native Hawaiian, Asian, and European descent. I think it gives me, not just me, but many of us, a unique perspective on being able to see different cultures, different way of doing things, and how we can pool many of I wouldn't say good parts, but many of the successes within those, how we can pool those, utilize it, and elevate it, but also how we can tweak it to fit other populations. So again, when we're talking about a policy that we create at a very macro level, then it's bringing it down to be able to understand different populations and how those tools can be used to be effective. And when you are a culmination of different people and you know, and different ethnicities coming together, I think you're able to just innately be able to understand how you can take what has been done well in one place, take it to another place, but know how to tweak it so that it can fit the culture of that community and that population that you're trying to address.
Okay, wonderful. Thank you. Yeah, I agree with you. We need to take the shared components applied to the different culture. And there's a lot of things like education and educate the caregiver, such as educate the policymaker regarding the cultural components. It can be done, and we all need to learn how to communicate. As a healthcare professional, we know how to communicate with the patient population from different cultural background. So thank you again for sharing your experience and insights. Let's see, we have, I don't think we have any other questions. We have a lot of grading from the audience. Okay. Okay, thank you very much, Dr. Balaz, again, for sharing your time and your expertise with us. So I think your insightful discussion should inspire us to critically thinking about the way in which we approach aging and what policy should apply to help our senior to age better, and while highlighting the significance of diverse perspective into our conversation. I really appreciate that. And in the end, I also want to thank Dr. Patricia Stone, who is the director of our Center for Health Policy, and Bridget and Quadra from our CHP for coordinating this event. Finally, I would like to thank you all for joining us today. Thank you.